Hello and welcome to my YouTube channel. My name is Osaze Ojo and I'm a consultant physician and rheumatologist. Today I'll be talking to you about a very interesting topic, which is gout. Now, if you have subscribed so far, I sincerely appreciate what you've done, and if you haven't, hopefully this video will convince you to subscribe. Now, gout is a very interesting topic because sometimes people think that all types of arthritis can be cured. Well, interestingly, this is one type of arthritis that can actually be cured. Now, what is gout? Just a little bit of some historical perspective to gout. Gout has been termed the disease of kings and the king of diseases. I'll take that again. Gout has been termed the disease of kings and the king of diseases. Now, what does that mean? We'll start with what it is called as a disease of kings. Now, historically, in times past, it was kings who had access to excess. In other words, they could have a lot of drink, alcoholic drinks, as well as a lot of meat. And so, this was a disease that was common in those that were affluent. Essentially, because they could eat whatever they wanted, they could drink whatever they wanted, and so it was not difficult to see gout occurring in kings, and so it was termed a disease of kings. And then what about king of diseases? The pain in gout is so excruciating that there is hardly any other condition that can give that type of pain, and so it is referred to as a king of diseases. So we see here a disease of kings and a king of diseases. Now, just before you switch off and say, oh, I'm not a king and I don't intend to be a king, and therefore this disease doesn't concern me. Hold on a moment. Now, with westernization of our diet, with modernization, capitalism, a number of people now have access also to excess. And so just like kings in time past, these people can also drink a lot and eat a lot. And so this same condition that used to occur in kings now occurs in those that are either affluent or overindulge. And so this condition, to an extent, may help you appreciate that well-known concept that too much of everything is bad. And that's not to say that only those that eat particular kinds of food or drink are exposed to gout. As we'll see down the line, there are other things that could result in gout. Now, given the historical perspective, we'll now discuss the cardinal symptoms. What are the cardinal symptoms in gout? Number one, pain. Now, the pain can be described as excruciating, can be described as horrendous, and if you were to ask somebody to tell you the severity of pain on a scale of 1 to 10, the patient may actually tell you that the pain is above 10. It's that severe. Now, to make matters worse, these patients are in so much pain that they cannot even put on their socks if they are men, or put on their shoes, and they find it difficult to walk. They may actually literally limp. And if they work in organizations where they have to put on a uniform, it becomes very difficult because they have to put on shoes, or if they are in, say, military or paramilitary organizations, they can't even take part in a march past. And so they're in so much pain. That's number one. Number two, swelling. In addition to the pain, that joint is typically also swollen. Number three, if you're light complexioned, you will notice the redness of the skin. And number four, down the line, you will notice discoloration or peeling of the skin around that area. Now, in terms of the joint involvement, the joint that is most typically affected is the big toe. Now, that's not to say that that's the only joint that could be affected. In fact, other areas could be affected, like the midfoot, the ankle, the knee, or some other joints in the body, but typically tends to occur in the big toe. Now, aside the cardinal symptoms and the joint presentation or the typical joint that's involved, we want to quickly look at the causes. What causes gout? Why do people develop gout? Now, there are a number of reasons. Number one, and very, very importantly, alcohol. Those that indulge excessive amounts of alcohol, beer, wine, spirits, can increase the chances of a patient developing gout. Number two, diet. People that take a lot of red meat, seafoods, as well as entrails of animals, liver, kidney, intestines, typically called enterals or orphals, they are actually at risk. Number 3, drugs or medications. People that take a lot thiazide diuretics. These are medications, water tablets given to make you pass a lot of urine. Now, these patients are also exposed or predisposed to developing gout. Then patients that are obese. Of course, if patients are obese, that's not the only reason, but there's a chance that patient may be either overindulging or eating an excess of these particular foods that are mentioned that could predispose to gout. Now, in terms of pathology, what essentially occurs? Why does the body develop such amount of pain from gout? What is the problem essentially? Number 1, when people indulge in these foods that I've mentioned or are predisposed to these excess amounts of urate in the body, essentially, we'll take alcohol as a prototype. Alcohol contains a lot of purines. Now, these purines are broken down in the body into uric acid. Typically, the body is able to excrete uric acid. However, in certain situations, either the amount that is being consumed is so high or the amount that is being excreted is too little, the amount of uric acid in the system becomes increased or larger than the body can cope with. So number 1, the alcohol contains purines. The purines are broken down into uric acid. Uric acid goes to the joint, crystallizes in the joint, and causes severe inflammation. It is this inflammation in the joint that predisposes a patient into developing the pain, the swelling, and the redness, which I have highlighted earlier on. Now, in terms of classification, there are a number of subdivisions, but for the purpose of this video, I need to mention that we could look at gout as acute and chronic. Now, for the acute gout, that patient typically will present exactly the way I've talked about earlier on, with the pain, the swelling, the redness. For a patient that develops repeated episodes, recurrent episodes of gout, this patient is predisposed to developing chronic tophaceous gout. In other words, they develop nodules, swellings around certain joints, particularly the elbows, the ear, could actually occur anywhere in the body, but these swellings are essentially deposition of urate crystals in the soft tissue. And the problem is that these depositions may be quite destructive over the long run. Now, in terms of treatment or making a diagnosis, the typical symptoms I've mentioned earlier on are very key in making a diagnosis. Also, blood test. The doctor will want to check for the serum uric acid, and the uric acid may or may not be elevated, and that may tend to throw people off sometimes. The fact that a patient has these typical symptoms doesn't mean that the uric acid will always be elevated. In fact, sometimes patient could have gout and still have a normal uric acid level. That's quite key. And also, a very specific test called polarized microscopy, where a small sample of the synovial fluid taken from the affected joint is viewed under very, very specific type of microscope to look out for the urate crystals. Typically, once it's found, that's clearly diagnostic of gout. Now, this video is not intended as a way of making you your own doctor. You still will need to consult a doctor if you do have some of these symptoms I've mentioned so far. Now, if this video has given you some value and you haven't subscribed, I think you can take out just about 3 seconds or 5 seconds to press the subscribe button today. Thank you as you do that. Now, in terms of treatment, I'm not going to be mentioning names of medications, but essentially the treatment can be classified into acute phase and chronic or long-term phase or cure. In the acute phase, the primary goal of the doctor is trying to ensure that he gets the pain under control, and so certain medications will be prescribed to get the pain under control. And then also, in terms of long-term, there are medications to bring down the uric acid level in the system, otherwise you are prone to having recurrent attacks of gout. Now, it's important I mention that there's a class of patients that have renal disease or kidney disease. When this happens, there's a tendency for them to have raised level of uric acid, because one of the areas through which excess uric acid is taken out of the body is through the urine. And so if you're not making adequate amount of urine because of a kidney disease, you're particularly prone. And there are aspects of treatment that could be carried out to mitigate this problem. Once more, this is not a video to make you your own doctor. Please consult your doctor. And so in summary, I've talked about gout, looked at the historical perspective, mentioned the cardinal features to involve pain, swelling, redness, and perhaps discolorating or peeling of the skin. I've mentioned the very important and the most crucial aspect of risk factors for developing gout, which is diet, particularly red meat and seafood, and then alcohol use. And the treatment is very, very rewarding because you can literally become cured from this condition. Once more, thank you for watching, and I hope you subscribe if you haven't done so far. See you next video.